Good morning. Thank you for attending our press conference this morning. My name is Eric Deaton. I'm the Chief Operating Officer for Ballad Health. I want to thank not only the media for being here, but also for the public for being in attendance of our virtual conference today. I really want to say thank you to our Ballad team members for all their hard work and dedication. They're doing an amazing job every single day taking care of our community and our patients, and it's very inspiring to all of us, and I just want to say thank you very much for all the great work that you're doing. A few updates. One is, first of all, our emergency department and outpatient visitation, we're changing that due to the increased number of cases in the community and community spread of COVID-19 in our region. Effective tomorrow morning, April the 8th, Ballad Health will no longer allow any visitors in our emergency departments or our outpatient facilities, such as our cancer center or our surgery center. We may permit a guest under extenuating circumstances to assist a patient, but those will be reviewed on a case-by-case basis and will be reviewed as needed. The only people allowed into a Ballad Health facility will be our physicians, our Ballad Health team members, and others who are required to care for our patients. The only exceptions to these areas will be the labor and delivery units, which will allow one visitor per room. And the neonatal intensive care unit at Nightingale Children's Hospital, as well as the rooms with pediatric patients, will also allow one visitor per room, and that will be the parent or the guardian. An update on personal protection equipment. First of all, let me just say that we have a very sophisticated supply chain here at Ballad Health, and I want you to know I have an extremely high level of confidence in our Senior VP of Supply Chain, who is Dale Clador. Dale is a very accomplished supply chain executive and is a lieutenant colonel and a Marine Corps veteran. So we rely on Dale. He does an amazing job. He and his team work tirelessly 7 days a week to make sure we have the appropriate supplies that need not only to take care of our patients, but also to protect our team members on a daily basis. We have projected our needs over the next few months, and we feel we have the appropriate number of supplies needed at this time. We will continue to monitor our supply needs on a day-by-day basis, and we'll make sure that the public is updated on that as we move forward. Something new that we're implementing, we've already implemented actually, and working with our local EMS to partner on, is something called Code Airway. Code Airway, it was implemented in cooperation with our regional EMS partners, and it really was implemented to help with the safety of EMS, with our team members, and for the patients. It's called Code Airway and will be used by EMS when when they're taking a patient to the emergency room, and when that patient is a possible COVID-19 positive patient. It's a two-way communication between Ballad Health EMS, between Ballad Health and EMS, and it's designed really for EMS to make sure that the patient is cared for appropriately and we have the appropriate PPE when the patient arrives. We created it to really make sure that our first responders and our emergency departments are working hand in hand with each other. And the way it works is that our EMS partners would call our communications center. It's already been established over the last few months, and they would notify the appropriate emergency department that the patient is being taken to. And then when the patient arrives at the emergency department, the team there is ready to accept that patient in a safe manner. This allows the ED and the patients to prepare for the patient's arrival, and also for when the patient is moved to an inpatient unit potentially, that inpatient unit is also prepared to take care of that patient with the appropriate amount of PPE. This designation really does follow the patient throughout the entire system and throughout their stay. The process really does make our community, our team members, and our EMS partners safer, and we greatly appreciate the partnership with our local EMS on doing this. Effective today, one last thing I'll mention is team member screening. Effective today, we will mandate the screening of all team members and visitors for fevers. So we're going to be taking temperature of all of our team members across the system. We actually will start it tomorrow morning. It'll take us about a half a day to get this implemented. We have been doing that pretty much across the system, but in all cases it has not been mandated. So we'll make sure that that happens moving forward. And the way this works is our team members with a fever of 100 degrees or higher will be sent home and be retested again within 72 hours. We will also ask that if any visitors come into our facilities or visit us, any of our locations, they would also be sent home, and they need to be monitoring their symptoms going forward. That's the only update I have today, but I want to give the floor over to Jamie Swift, who's our Director of Infection Prevention. Jamie.
Thanks, Eric. And again, thanks to our media for being here today. I want to provide you with a quick update on our numbers and kind of tell you how we're going to change our reporting processes. So as you all know, our states are doing a great job of reporting the numbers at the same time every day. And our numbers are reported up through those state numbers, both in Tennessee and Virginia. So those are really our most accurate numbers. And so we really want to start focusing in these press briefings on exactly what resources Ballad has at this point in time. So today we can tell you that we currently have 13 patients with COVID-19 who are inpatient within our facilities receiving care across our Ballad Health system. We do have over 200 dedicated COVID beds, so we are prepared for many more patients should that need arise. We have the necessary PPE and the resources to appropriately care for our COVID patients. I really want to take just a little bit of time and focus on the community spread and how the numbers that we're seeing truly reflect community spread. This week within the test that Ballad did and we received, we had positives in the age range of a 6-week-old infant up to 90 years old. So we know with those age ranges, it's truly across the board now. It truly is community spread. So we really just want to ask our partners to focus on staying at home, social distancing, making sure that you're connecting to people electronically, but really staying apart, staying at home. Wearing the face coverings is recommended as you go out if you're going out. So that's the best way that we can really slow this down and prepare our facilities. And that's all I have at this time, so I will turn it over to Lisa Smithgall, our Chief Nursing Executive.
Thank you, Jamie. I'd like to take the time to talk with you today about what you may have heard about wearing a cloth face covering in the public. President Trump and the CDC are now recommending that members of our communities wear a cloth face covering as you go out in public. We do have an example of a mask on our website that can show you how to make a mask that has triple layers and has the capabilities to be something that you can wear when you go in public. In addition, it's important to remember that the cloth mask that you're going to wear if you're in public is protecting others from your droplets and the air particles that you expel when you talk. So it doesn't protect you necessarily from the infections that are in the environment. So it's very important that, again, you do the physical distancing of 6 feet. Just because you wear a mask doesn't mean that you're safe and can go all around that you need to do. We still need you to stay at home as much as possible and maintain physical distancing. I'm going to show you how to wear your mask safely and protect yourselves. So first of all, you want to make sure that the mask covers both your nose, your mouth, and goes around your chin. You put it on. And it's important to remember not to touch your face or adjust the mask. I'm going to take the mask off by the ear loops, and you don't touch it, and you would put it into a paper bag, or you can drop it directly into your washing machine. Again, it's important that you don't touch your face or the mask once you have it on, and if you do, that you immediately wash your hands or sanitize. As soon as you take your mask off, wash your hands and sanitize. You also want to make sure that you wash the mask in your standard washing machine on hot water with soap, and that you thoroughly dry it before you wear the mask again. We have an example of how to wash your mask. That'll also be available on our website. I also wanted to take a moment to talk to you about some things I've seen in the community. And I recognize that people want to protect themselves in light of the coronavirus that's in our community. I've seen people wearing gloves. And again, you do not need to wear gloves as long as you wash your hands thoroughly and use hand sanitizer whenever you touch surfaces that other public individuals have touched. However, if you're going to wear gloves, it's critically important that you don't touch your face or touch your personal surfaces. I think people have a false sense of security sometimes when they wear gloves and they touch things that they don't think about because they think they're protected. Again, if you touch the gas nozzle or the buggy at the grocery store, as soon as you're done touching those things, take the gloves off without touching them, wash your hands or sanitize, and then touch your own things without the gloves on. Thank you very much. At this time, I would like to introduce Alan Levine, our President and CEO.
Thanks. Thank you, Lisa. First of all, let me let me say a couple things. You heard Eric talk about the code Airway. Really proud of the team putting that together. The communication system that we're using in order to implement that is the communication system we put in place when we made the changes to our trauma system a year ago. If you recall, the changes to trauma also involved creation of a regional communication system, so there was better communication among all hospitals and EMS, and we were able to piggyback onto that system in order to deploy Code Airway, which I think is a really great partnership between Ballad and the emergency medical services. I want to thank everybody for their prayers for Dr. Lewis. I spoke to his wife Jessica last night. She was in good spirits. She's, in her words, they're abundantly blessed with friends and people that they don't even know who are reaching out to them. And I think that we're all very grateful when our own team members are being impacted. The reason that we're taking such aggressive steps right now towards limiting all possible visitation is when you look at the stories that are now emerging. Beaumont Health System in Texas with 1,500 team members that are positive or quarantined, and Henry Ford Health System that has several hundred of their team members that are quarantined. Clearly, that's just not something we can afford to have happen here, and so we're taking every step we can to protect our team members, and that's critical. And I'm going to come back to that in a minute. This Thursday, we'll have more information about this, but we plan to stand up some very aggressive access points for telemedicine. Our team's been working on this. We've been using telemedicine for a long time. All of our emergency departments are currently linked into Nice Longer Children's Hospital for access to pediatric specialties. I think we're in more than 100 schools right now providing access to telemedicine visits during school when schools were open. We're using a platform that we invested in back in December to stand up a very massive access platform for telemedicine access, not just for physicians, but also for urgent care. And we'll have more to talk about with that on Thursday with details about how to access the telemedicine. And this is something that I think will be very beneficial for people who right now might be concerned about going to the doctor, but who need to actually be seen by a doctor. And so we're looking forward to releasing more details about that on Thursday. I had a conversation yesterday with Stuart McWhorter, who's, as you know, the leading unified command for the state of Tennessee on behalf of Governor Lee. We had a great conversation about surge capacity and some work that we're doing in partnership with the state and with the Army Corps of Engineers. We are collaborating with the state and with the Corps of Engineers. We will leave it to the governor to announce whatever steps that they wish to take, but Ballad Health is working lockstep with the Army Corps of Engineers and with the governor's staff to make sure that what we do is coordinated and beneficial for our region. As you heard from Jamie, right now we believe we've got the capacity to serve. We're modeling every single day what the spread looks like and what we anticipate could be the result should we see a continued increase in the cases. And right now we're comfortable that we have the PPE and that we have the capacity to take care of our community. Now, along with that, there's a need to plan for that surge. Tomorrow morning, we will have a special, if you will, press avail to talk about some steps that Ballad is going to take this week to try to address the expected increase in demand, to make sure that we've got the appropriate staff, the critical staff to be in place, and some other steps that we're going to take with respect to how to mitigate the financial damage that's been done to so many of our team members and to Ballad Health. And we will be able to talk with more clarity about that tomorrow. So I'm not going to answer very many questions about that today, but I will say that that tomorrow morning we will have a lot of very detailed information to provide both for our team members as well as the public. Over the course of the next week or two, there will be some consolidation of services that will take place, and we'll talk more in detail about that this coming Thursday. But we are as you see the volumes continue to be as low as they are, there's some rational steps that we need to take, both to reduce the unnecessary use of PPE, but also to make better use of the limited resources that we do have. I'll end my comments just by saying I'm grateful for the number of people in the region, from owners of businesses to folks that are just neighbors, who have reached out to provide PPE or to offer their help. I think there's as I said a few of these meetings ago, there's you often see the best in people during tragic situations like this, where people have been shaken. This has been very traumatic for everyone: business owners, employees, our physician partners. All of us have been shaken by what's happened, both clinically as well as what's going on with the economy. We're continuing to be concerned about that, and continuing to encourage people. Do talk to somebody if you feel the stress, if you feel that it is, as I've said from the beginning, it is a sign of strength to seek help when you need it. It's not a sign of weakness. And I encourage anybody who feels that they need to talk to somebody. You can go to our website, our www.balladhealth.org/COVID-19. We've got information on there about where to access behavioral health services. It's incredibly helpful to do that when you feel that you need that help. So with that, I'll end it, and I'll answer any questions anybody has.
All right, first up, we have Brandon Bacamian with the Johnson City Press. Brandon, do you have any questions?
Yes. I was particularly curious about Ballad Health's involvement with the Department of Health Medical Reserve Corps, if there is any involvement with that. Are there any physicians or practitioners there opting to offer up services, and what is Ballad doing in coordination with the Reserve Corps or any initiatives similar to that?
Well, great question. The question was whether or not we're linked up with the Medical Reserve Corps that the Department of Health has established. And I think a few of these meetings ago, we encouraged people and gave the phone number for people to contact if they want to participate in the Medical Reserve Corps. And we certainly hope people will do that. The purpose for the Medical Reserve Corps is to provide additional support if our staffing capabilities get stretched. And in the event we do face a surge in which we are limited with our staff, we would want at that point to be able to tap into whatever staffing resources we have, plus the Medical Reserve Corps, which is administered by the state. So yeah, we encourage people to, if you're a retired healthcare professional, by all means sign up for it, because your services may be needed at some point.
Brandon, do you have an additional question?
I think that covers it. Thank you.
All right, thank you very much. Next, we have David Floyd with the Johnson City Press. David, do you have any questions?
Hey, I do. Alan, can you talk a little bit about there's been mention of increases in the visitation restrictions at Ballad facilities. What are you guys doing to ensure that family members, I guess we have anything special to ensure that family members can stay in contact with COVID-19 patients, and are you guys providing updates to them on their conditions on a regular basis?
Yeah, that's a really good question. And here's the interesting thing. I mean, normally when in a normal operations where family members are there with the patient, and nurses are going in and out of the room and doctors are going out of the room, there's an opportunity for interaction between the caregivers and the families. And now, because of the lack of connectivity of the families in the room, a lot of times things that are fairly routine and seemingly mundane for a nurse, now those small little subtle communications aren't taking place. And that can leave a family feeling disconnected and in some cases frustrated. Lisa Smith-Gall and I had some discussions about this just the other day. And look, I've experienced it as a family myself with a loved one that we have that's in a hospital in another state. And it's been difficult to be able to get information. And it's because we're not there. And so what we are trying to do, particularly for patients that are in the ICU, if they're communicative, if there's technology capabilities for nurses to connect them to their family members, they'll assist them with that. And we've had some great stories about nurses that have done that. In fact, one of them was highlighted by Katie Couric on her podcast, where a nurse went out of her way to help an elderly woman communicate with her family. And we encourage that. there are other circumstances where it's possible that the family may not feel as connected. And Lisa's working with her team right now to figure out how to create what we call standard work to make sure that that becomes really a part of the routine for the nurses, things that they would otherwise consider to be just subtle ongoing communications that are not happening now. We want to make sure that we're connecting to the loved ones, or certainly those who are the designated folks in the family who are responsible for the care of the patient. So yeah, that's a great question. That's a really important issue because there's a lot of fear out there right now.
David, do you have an additional question?
I do, and the other one was about the $10 million in grant that the governor announced yesterday for rural hospitals. Do you know if Ballot's going to be receiving any of that money, and how significantly would that move the needle as you guys do?
I think that there are a number of rural hospitals in Tennessee that will benefit enormously from that grant. And I could not applaud the governor more for taking that step. I think there's a recognition that these rural hospitals are struggling. Because Ballad Health was created, our rural hospitals in our region, even though the majority of them on a good day are losing money, because of the unique structure of Ballad, we have been supporting those rural hospitals. And so our position is if we have rural hospitals that qualify for those funds, our first priority is to make sure that other rural hospitals who are struggling and really are facing a definitive questions about whether or not they can keep their doors open, we definitely think that in terms of what's best for the state, that we allow those hospitals to be first in line. Certainly, once those are resolved, then if Ballad Health hospitals qualify, we certainly would want for our hospitals and our communities to be able to take advantage of that. But again, this points exactly to a clear benefit. The majority of our rural hospitals in the 21 county service area that we serve lose money. They were losing money before the merger. They were losing money before the pandemic. But because Ballad Health has been in a position to help subsidize those hospitals, we haven't had those hospitals fail like you've seen in other parts of the country. Now the problem we have is those hospitals that have historically been subsidizing the rural hospitals, those hospitals themselves are now losing money. And that creates a different cascade of problems for us. And so, but our priority is to make sure that the hospitals who need those dollars the most for pure survival, we want to make sure they get to the front of the line, and then Ballad Health will take its appropriate place in line. That's, from our perspective, while we certainly have the right to apply for those dollars, we think the right thing to do for the state is to be respectful of those organizations that really have a much bigger immediate problem than we do.
Thank you, David. Next, we have Mike Still with the Kingsport Times News. Mike, do you have any questions?
Yes. First, the once-a-time hospital where it's been converted into basically a COVID-only treatment facility. That's correct. How many patients is that hospital handling at this time?
Right now, there's one patient in that hospital. It has the capacity to go up to about 30 patients. And so again, that's part of our surge plan, is to, wherever possible, keep patients closest to their community if they have low acuity needs. If their needs become more high acuity, whereas if they might need ICU or ventilator level of care that can't be provided in the local community, we would transfer those to the COVID units at Holston Valley, Bristol, or Johnson City Medical Center. And then beyond that, both Lonesome Pine as well as Greenville Community Hospital West, we are considering additional COVID capacity. In other words, those are there for additional capacity that could serve patients that may not even be from Wise County, depending on what happens with our overall capacity needs. But those two hospitals are considered part of our COVID capacity for the surge.
Mike, did you have another question?
Well, I don't think I got the first answer. How many patients right now are COVID patients are actually in Lonesome Pine?
I did answer that, Mike. I said currently we have one, but it has a capacity to go up to 30.
What levels of actual testing do you have available
I think right now we have, well, we have tested well over 1,000 people. Yeah, I mean, we just in terms of capacity, when you talk about testing, we have more than 21 sites throughout the region where you can go to be tested. There's right now no limitation on the testing that we can provide. So you've got the locations that you can go to, and then there's the guidelines that we use, which are provided by the Centers for Disease Control. We use those guidelines to determine who is appropriate for testing. If somebody can be drawn at one of those remote locations, they'll be drawn at a remote location. If they have more serious symptoms, they're likely to be referred to one of our emergency departments where they will be tested. Now, Ballad Health is the only health system in Tennessee that I'm aware of. I'm not sure about Virginia, that has the ability to do rapid testing. So if you show up in one of our ERs with severe symptoms, or if you're an inpatient in our hospital, or if you are a staff member that's been exposed, we have the ability to do rapid testing where we could turn the result around within a few hours. And so right now, our resources are pretty good with testing. We have ordered another lab analyzer, a piece of equipment that we expect to be here within a few days. We have a capacity of rapid tests of 50 per day now. We will be able to do up to 400 per day once that new analyzer is here within a few days. And beyond that, we've ordered 3 additional analyzers, which will increase our capacity even more. So those investments are hopefully days away from bearing fruit. But right now, we don't have limitations in our ability to test.
Thank you, Mike. Next, we have Richard Lovett with Cumulus. Richard, did you have any questions?
Yes, I have one. It sort of piggybacks on Mike's question about testing. Alan, since the rapid testing was unveiled last week, has that gone pretty smoothly and within the timeline and time frame that you all were projecting, say, hours instead of days?
Absolutely, it has. And in fact, the one area where it's been the most help is if we have patients that are in the hospital that they're patients under investigation. In other words, patients that we've admitted that have symptoms that need to be in the hospital. Previously to having the rapid test, we were having to send those tests out, and it could take 3 or 4 days to get the results back. And while those patients are in house, while we're certainly treating them appropriately, we don't know if they're positive, and therefore we're using a lot of personal protective equipment because we're assuming that they're positive. By getting them rapid tested, we're converting those from what we call PUI, persons under investigation, to either positive or negative, which is really helpful. Frankly, it's very helpful to our team members. And so that's been the area where we've seen the biggest help from that. Now, of course, we're limited to 50 per day right now, but that's 50 per day more than we had a week ago. And soon we'll be able to do up to 400 per day.
Thank you, Richard. Next, we have Blake Lipton with WJHL. Blake, do you have any questions?
Yes. I think Jamie mentioned it a little bit earlier. I think she said 13 patients hospitalized, but one thing we want to know is how many are in the ICU and how many are on ventilators?
We have two that are in the ICU, and both of whom are on ventilators at the moment.
Did you have an additional question, Blake?
Yes, and you mentioned it a little bit too as well, Alan, about how Dr. Daniel Lewis, how is he doing? And with a younger guy like this, is there anything we should take away from someone like him having this serious of a condition?
Well, the takeaway is that this is a serious issue. Dr. Lewis is a young man, otherwise very healthy. And, it's easy to take comfort in assuming that you're not really going to be seriously affected by this unless you're elderly or have comorbidities, which is true. The majority of people that face the most serious repercussions of this are in those categories. But that doesn't mean it won't happen. And it can happen. And the stories that you hear from young people who are affected by this is a ravaging illness that causes real problems with your ability to oxygenate. And so, and it's painful. So I don't want to get into giving reports on Dr. Lewis's medical condition because I'm not a physician. I would refer you to his Facebook page because he's certainly giving updates, or his wife is. But he's an amazing guy. He's a phenomenally popular doctor. He's a very highly competent chief medical officer within our system, and a huge advocate for our team members and our patients. And I'm really grateful for all the prayers that people have offered up for him. We're optimistic that he's going to be okay, and we'll just keep praying for him.
Thank you, Blake. Next, we have Jonathan Roberts with the Johnson City Press. Jonathan, do you have any questions?
Yeah, I wanted to ask about the lessons Ballad is taking away from this pandemic, both from a public health standpoint and also from a logistical standpoint as a health system as a whole.
Well, there'll be some time to sort of do a retrospective review of what went well, what didn't go well. I think any emergency response always lends itself to doing a sort of a post-review. We're taking copious notes of everything that's happening. We're documenting everything so that we can learn from it. Here's what I will say, and I don't think this is just my opinion alone. I think the fact that we are one healthcare system with the capability of maneuvering within our capacity and making decisions and executing on decisions, I cannot imagine what it would be like right now if we were still Mountain States Health Alliance and Wellmont Health System in this region. Eric Deaton was the chief operating officer of Wellmont prior to this, and Lisa Smithgall was the chief nursing executive for Wellmont. You've now got the best and brightest of both systems working together to solve problems instead of bumping into each other in these different markets. And I think a lot of people, when they look back on this, hopefully they will draw the same conclusion that we are, which is whether it's using the consolidated trauma system, communication system that we've put in place to now help us with our connectivity with EMS, or making decisions that seem easy, if looking in from the outside, that seem easy. These are not easy decisions. And there's a lot of logistics that go into these things. And the inability to do some of what we're doing, like stand up COVID facilities and using excess capacity, that excess capacity might not even exist if we hadn't sort of come together. So I really believe one of the lessons learned here is coordination and execution are two of the biggest, most critical factors to responding to any kind of emergency. So there will be an incredible amount of time. And the one thing I would encourage everybody to do when we get through this is once there's a time to do a post-review, that's when everybody has to be honest about what they saw that worked well, what didn't work well, so that we can definitely learn from it. I remember in 2005, while I was still serving as Secretary of Health in Florida, when President Bush at the time raised the issue of a potential pandemic. He had read the book Outbreak, or no, the Great Influenza. He read the book The Great Influenza and came back from his time off and sort of triggered an entire federal and state response in all 50 states about we need to come up with a pandemic plan. And a lot of the things that you see that are happening in terms of looking at identification of cases, isolation, and then tracing, those are things that emerged out of that planning. And I think now that we've been through this, I think there's an opportunity for us to realize this can happen again. And we've got, as a country and as regions, we've got to make sure we're consistently testing ourselves so that we can test our capacity to be able to respond to things like this.
Jonathan, do you have an additional question?
No, that's it. Thanks for the time.
All right, thank you so much. Next, we have Eugenia Estes with the Greenville Sun. Eugenia, do you have any questions?
Yes, it's sort of related to the Dr. Lewis situation. I was just wondering, has Ballad got any guidance from maybe the CDC about medical care workers maybe having a higher susceptibility to more serious complications just from the amount of exposure? And I guess that underscores the importance of the protective equipment.
I think healthcare workers are more likely to be exposed. I don't know that there's any guidance that the severity is any different for healthcare workers, but clearly they're at much higher risk of exposure.
Do you have an additional question, Eugenia?
No, I think my
Marshall Herald-Courier. Dave, do you have any questions?
I do, thanks. And this may be a Jamie question. The Tennessee Department of Health is including 290 out-of-state cases in its count today. And I know Ballard reports both Virginia and Tennessee cases. Could you guys speak to how that works? You know, are there Virginia cases currently in that Tennessee listing that are coming from Ballard facilities?
No, so we would test through our appropriate ballot facilities and report those based on county of residence. So the way we're testing and reporting, those are going into the appropriate state numbers.
Dave, do you have an additional question?
No, I think you guys answered everything else. Thank you much.
All right, thank you. Next, we have Richard Rourke with the Irwin Record. Richard, do you have any questions? All right, next we have John Engel with WCYB. John, do you have any questions?
Yeah, Alan, last week you said that Ballard was on pace to reach capacity in 40 to 70 days without further medication, just given the current rate of spread of what we're seeing in the community. Yesterday, I talked both anecdotally with you and Jamie about the new IHME models from the University of Washington. Did that data reflect at all what you're seeing in your internal modeling from Ballad Health, given that there were some promising takeaways from that?
Great question, John. Yeah, you know, that model and the Penn model both inform the modeling that we do internally, and it definitely, I think it's very encouraging that, you know, what we're seeing in the modeling is what we're hoping to see, which is we're trending towards hopefully a flattening, and that comes as a result of the work that's being done to socially distance each other, and so we're praying that that trend continues. Now it's not a trend yet. You know, right now they're just data points, but as we start to see a trend, hopefully, if it trends in the way we're hoping it will, then that would push back when we would hit capacity. And hopefully, if we keep at it, we never actually hit our capacity. That would be the most ideal situation.
John, do you have an additional question?
Yeah, this might be a better question for the infection prevention, but can you give us an update on the situation with the Hawkins County cluster, and have we seen any further exposure to Ballad Health team members? Since you gave the update, I think you said 4 the last number that we got.
I present to you the infection prevention czar.
Thank you. So we, you know, as you've seen on the state website, there are more numbers in Hawkins County. Most of those are from the community. We do see that 5 team members within Hawkins County that are positive. We've not had any positives here recently, so I feel like that cluster is probably contained. And, you know, at this point, we're just looking at community spread.
All right, thank you all so much. That concludes today's media briefing.
Thank you.